Hi, I'm Dr. Jordan Alger. I'm a urologist here at Urology Associates. I treat general urology in all conditions, but I specialize particularly in robotic surgery for the treatments of urologic cancers and malignancies, as well as the treatment of BPH. There are a large variety of surgical therapies for men who have prostate enlargement, and really many of them are variations on a theme. Again, because the urinary symptoms come predominantly from obstruction of the urethra, the prostatic urethra, many of these therapies involve increasing the diameter of that channel, whether by tenting them open with something called like a urolift, where you actually push the prostate back, or therapies like a TURP, transurethral resection of the prostate, where you actually resect or remove prostate tissue to increase the force of urination. There are some newer technologies, and this is why it's a very exciting field in urology. One of the procedures that I do for men who have enlarged prostates is something called aquablation, where essentially the therapy uses the high-pressured saline irrigation, essentially a water jet. I like to tell patients it's basically like a high-pressurized power washer that you would use for your sidewalk, except it's a very small one that goes along the urethra, and it is used along with ultrasound feedback to map out a channel through the prostate, and the water jet sprays back and forth to increase the caliber of that prostatic urethral channel. One of the main benefits of aquablation really stems from the fact that the tried and true methods for many years, like the TURP, or transurethral resection of the prostate, would result in a high rate of what we call retrograde ejaculation. Men would be able to have intercourse, but there would be no ejaculation because the mechanism for ejaculation was damaged or affected by the resection itself. Aquablation is unique on the market, with the exception of maybe urolift, where the vast majority, up to almost 90% of men, may have preserved normal ejaculation, which is a real benefit. One of the other major benefits of aquablation is that it's much faster than many of the other resection procedures that we perform. Typically, these procedures can be done start to finish, and the patient is out of the OR in under an hour. After patients undergo an aquablation, they will spend one night in the hospital. They'll typically have a catheter in place that they may go home with. In some cases, we're able to remove the catheter the very next morning after surgery. Sometimes we're not able to, though, because there is a slightly increased risk of bleeding with the aquablation. This stems from the fact that, unlike other therapies, aquablation does not use a lot of heat or thermal energy to stop or cauterize the bleeding. The trade-off is that there is a little bit more prolonged bleeding, which is why the aquablation is not appropriate for men who are on active blood thinners. So a common question is, when do you decide whether you have to have a surgery or not? I tell them this is a quality of life surgery, and that if they are satisfied and otherwise doing well on a medication, they could continue that way. But many of these procedures can be done quickly, safely, and effectively, and completely remove the need for them to ever take medications again, which is a real benefit when you think about the years and decades many of these men have left to live. The good thing is, when you come to Urology Associates, we specialize in all of these procedures, and so really we feel that there's a treatment out there for each and every patient that we see, and we will do our best to make sure that they're satisfied.